Many people ask me, Doctor, are sweaty hands and feet contagious to family members? The answer is no, but it can be hereditary. The truth about this condition, which affects 3% of the population, will surprise you. Many people suffer from sweaty hands and feet, which causes them to feel self-conscious and struggle in social relationships. They face this condition regardless of whether it is the hot or cold season. Sweaty hands and feet, medically known as hyperhidrosis, is a condition characterized by excessive sweating in the palms and soles beyond what is considered normal. In the human body, sweat glands function to secrete sweat and regulate temperature. However, in certain areas of the body, sweating occurs excessively, negatively impacting the patient's quality of life, daily activities, and work. However, regarding sweating in the hands and feet, we must determine whether it is due to a primary or a secondary cause. Secondary causes. This means the sweating is a symptom of other pathologies such as hyperthyroidism, where the patient experiences hand sweating accompanied by other manifestations of the thyroid condition. Primary causes. This is a condition of excessive sweating in the hands and feet without any accompanying disorders from other diseases. This is called primary hyperhidrosis. The majority of hyperhidrosis cases are primary, accounting for about 3% of the population. So, what is the cause of sweaty hands and feet? And does this pathology have a genetic factor? For primary hyperhidrosis, the cause is mostly idiopathic, unknown cause. Currently, we cannot pinpoint the exact cause, but that doesn't mean the patient has no cause. Pathophysiological studies indicate that it is due to sympathetic overactivity, increased sympathetic tone. Our body has two tones within the autonomic nervous system, also known as the vegetative nervous system, the sympathetic and the parasympathetic. This system regulates all involuntary activities, including sweating. When the sympathetic tone is overactive, it leads to sweating in the palms and soles far beyond normal levels. Regarding genetics, it has been recorded that there is a hereditary factor, and the prevalence varies among different ethnic groups. In a family, if there is someone with excessive hand or foot sweating, their direct relatives have a higher probability of having the condition compared to others. Excessive hand sweating affects certain jobs that require manual dexterity. However, excessive foot sweating, sometimes even dripping, is a severe condition with dangerous complications. Because the feet are always wet, it causes slipperiness, leading to falls and injuries. Many people wonder and complain to me, asking if their sweaty hands and feet were caught from their family members. I want to affirm, hyperhidrosis is not an infectious disease, so it will definitely not spread to those living with you. However, because there is a genetic factor, if someone in the family has it, the risk is higher for other members. So, what are the current treatment methods for sweaty hands and feet? And which method brings the most benefits to patients? Currently, treatments are divided into two main groups: medical treatment, medication, and surgical treatment. From the perspective of Western medicine, the most effective treatment is still surgery, specifically the sympathectomy, cutting the sympathetic ganglia located near the spine. For sweaty hands, the doctor will surgically cut the sympathetic ganglia near the thoracic spine. For sweaty feet, the doctor will surgically cut the sympathetic ganglia near the lumbar spine, specifically at the L2, L3 vertebrae level. Surgery is the most radical and effective method, helping the patient resolve the issue almost immediately after the operation, with an efficacy rate of up to 95 to 98%. One of the side effects after surgery is that the temperature of the soles of the feet will increase by about 0.5 degrees Celsius, and then the body will gradually readjust. Your body may experience compensatory sweating, compensatory hyperhidrosis. For example, after surgery to treat foot sweating, you may experience compensatory sweating in the abdomen and lower back. Typically, the body will adjust back to normal after 6 months. However, if the body does not self-adjust after 6 months, you should accept it as a part of the treatment process. So for children with sweaty hands and feet, often referred to locally as night sweats, we recommend doing nothing and not performing surgery. The reason is that the anatomical structure and physiological functions of the human body only stabilize after the age of 16 to 18. In many cases, children have hyperhidrosis, but after they complete puberty and their bodies stabilize, the condition disappears on its own. Only if the condition persists after puberty and affects their studies and daily life should treatment be considered. If you found this useful, please share it so everyone can know. Thank you for watching and see you in the next video.